Hello, friends. Welcome to our coronavirus outbreak conversation. And today we will discuss what's going on, what is the impact, and globally, as well as we are focusing on Bangladesh. And first of all, I need to introduce my panel. With me, Ambassador William B. Millam, Senior Scholar of the Wilson Center, and President of the Right to Freedom, a Washington-based right group, as we are working for this, and is the former U.S. Ambassador to Bangladesh. And we are delighted to have our one and only brave and vibrant photojournalist, Shahidul Alam. I don't need to introduce him, so everybody knows him, Shahidul Alam. He's joining with us from Bangladesh. And from Phnom Penh, Dr. Zia Hyder, a senior nutrition specialist and public health expert of the World Bank. So Dr. Zia Hyder joining with us from Phnom Penh, and Sabria Choudhury Balland. She's working for Right to Freedom as board member. She's an eminent writer and English and French teacher. She's joining from Texas, from the United States. So welcome you all. How are you, Mr. Shahidul Alam?
Well, you're talking about this right now, and I can actually hear people crying out in the streets, hungry people crying out for food. So that's the reality that we face.
Yeah. So how are you, Ambassador Bailey?
Me?
Yeah.
Well, I'm not in the same position as Shahidul. I don't hear hungry people crying out in the streets, thank God. And I do feel for those people. We aren't quite to that situation here in the U.S. yet, although we do lead the world in cases and in deaths, I think. I don't know about the deaths, but certainly in cases. And we're not doing a very good job of it. But I've said all this before. I'll say it later when you've talked to the other panelists.
Okay. Dr. Zia Hyder, how are you?
Well, I think this is a bit difficult question, right at this moment. I don't think anybody in the world, especially people in Bangladesh, anybody in there, they're doing well. But I'm lucky to be in Cambodia. The Cambodia is one of the very few countries where the government successfully contained, this virus, this COVID-19. At the moment, the country actually doesn't have any active case. Only 122 patients were identified. All of them got treated. But of course, we are crossing fingers. Hopefully, we can keep up, with this good status of the country.
Ms. Sabria Choudhury, how are you?
I'm doing very well, thank you. I'll reiterate some of the same things that other panelists have said. Considering the circumstances that we're experiencing globally, I'm very thankful to be okay.
Let's start with Shahidul Alam. And we all know you suffered a lot for free speech. 120 days of imprisonment, tortured like anything. And at that time, virtually whole world stand beside you. So after that long standing, still the Bangladesh is facing, freedom of press and freedom of expression. Bangladesh, but the people are facing the freedom of speech is not there. And regime is in zero tolerance on freedom of expression. So what is your observation?
Well, it's ironic I'm talking to Bill here and with you, three of you in the United States, because the US history doesn't really make it a particularly good country to be commenting on this at this stage. I mean, we remember the US role in 1971. We know Guantanamo Bay, what the US has done in Syria, in Libya, in Iraq, in creating people like Gaddafi and Bin Laden and things like that. And of course, the Jakarta model, where millions have been killed across the globe because they believed in communism. You've got a situation where Assange is being extradited for the very same reason, because he, very interestingly, Assange was someone who gave information to the public on corporate and government misdemeanors, and he's now being threatened in collusion with US and the UK trying to get him convicted. So all of those things are there. But there is, I think, one interesting similarity between US and Bangladesh, which we can begin upon. I think I was looking at the latest reports which say 84% of the US people don't trust their government. Well, it's probably a bit more than that in this country, so we do have similarities as well. So perhaps there is some common ground. But we are talking of COVID, and certainly one of the things which is very problematic today is the lack of transparency. I mean, obviously, this is a very important issue. The public needs to know, the public needs to trust the government, there has to be a level of transparency, yet whenever journalists have been reporting on things, whether it be the theft of rice or misappropriation or any of those sort of things, they've ended up in jail. And very recently, Didar al-Islam Bhuya, who was one of the coordinators in a group we'd set up to monitor the government response to COVID-19, he was arrested, and he is still in what is called Amdani, which is where you have the highest concentration of prisoners. So at a time like this, when we talk about isolation, that is happening. Then you have the recent situation where we, on top of all these things that are happening, we have the Amphan, the cyclone. And just very recently, a photographer who sent photographs from Khulna, where people were praying in the water on Eid Day, has now gotten into trouble because he, according to the government, was putting the government in a bad light. The government remembers the Aftab Ahmed photograph of the famine in 1974. So I suppose those are sensitive issues. We've got a minister who says not a single person has gone hungry in this country. Yet, right now, I can hear people in the streets. It's nearly 10 o'clock at night. It'll go on to midnight. There are people crying in the streets. I mean, does this minister live in a different planet? We don't know what the hell is going on. But we've also got very practical issues to consider as well, quite apart from the repression. The fact that it was such a poorly thought out plan. I mean, firstly, the first reported death was on the 18th of August, the 18th of March. Now, we all know why the first bad news had to come after the 17th of March. I interviewed the principal of Dhaka Medical College earlier, and he was reporting that he had a meeting with the health minister in December when they were planning what was going to happen. So if they had that meeting in December, for nothing to have effectively taken place until the latter half of March is quite ridiculous. And then when things did take place, they were done in such an ad hoc manner, in such a ill thought out manner. I mean, last night, there was a fire in United Hospital. The hospital was told, as were all hospitals, to set up a COVID-19 unit immediately. And they did so hurriedly, but they didn't have the fire precautions that were necessary. And all five patients have died. So this is what's happening. But for me, what's more concerning is the fact that we now have a situation where decisions are not being made on public interest, but on business interest. So we know that Zafrullah Choudhury's group, Ganeshastra Kendra, announced that they had come up with this cheap, effective kit. Now that needed to be tested, and they have no objection to that. They just wanted to be tested. But the government has been dragging its feet on doing these testing, whereas the remdesivir production has been fast-tracked, tests by other organizations have been fast-tracked, and because GK is not in a money-making racket, there's nothing to be made out of it. So that's getting shelved. So that's a situation we're in, and it's a precarious situation. People are dying, yet we're playing politics.
Yeah, thank you very much, Mr. Shahidul Alam. I need to mention Shahidul Alam's recent book, The Tide Will Turn. Recent book, and the Shahidul Alam we know, but I need to mention that he's the Time Magazine Person of the Year 2018, and he's the founder of Pathshala and Tree Picture Library. So we are delighted to have you and your wonderful observation on Bangladesh, and and you are on the spot, so you can describe what's going on than any others which we are in panel.
Mushfiq, maybe I should interrupt because I think it would be improper of me not to mention the fact that there's a lot of good that's also happening. The average person in Bangladesh is doing really tremendous work. There are a large number of groups who are out there helping one another. There are medical workers. A large number of people have taken tremendous risks to stand by other people. And whereas we would, in a situation like this, expect the government and the bigger organizations to be playing a role, smaller organizations, individual people have really been an example. So I shouldn't merely place a negative impression. I think ordinary people deserve a huge amount of credit, and particularly the health workers who've been exemplary.
First responder, absolutely. Yeah, and then now I want to ask Dr. Zia Hyder. You are working for the World Bank, and you are a public health expert. So why did global health governance fail to address this pandemic? What is your observation?
Thank you, Mushfiq. I think this question is not so easy to answer, and there is no single answer. First of all, health is in most of the countries, especially in developing country, is one of the neglected agenda. If you look at budget allocation, health expenditure, per capita health expenditure, then it will be very clear, how low the health expenditure is, public expenditure is for most of the developing country. If I go to Bangladesh, for example, in Bangladesh, per capita health expenditure is only $32 per year, which is one of the lowest in South Asia. Not to talk about other countries in East Asia or other middle income countries. So that is one of the reasons why overall the health is still a neglected agenda. And this COVID-19 actually pointed to that issue very clearly. It made it very clear to everyone how neglected the health is at large in many countries around the world. Even the richest, the most powerful country, the United States, we have seen how vulnerable they are to this virus. People died in and out in many large cities in the US. Also, there are a few other issues. For example, WHO has the global kind of mandate to advise member states regarding health. But if you look at the financing source of WHO, they've been also suffering from the similar crisis. Their financing is pretty limited. And you have seen how Mr. Trump, you may not be very proud of him, but there are many people who are proud of him. He basically declined financing the WHO. And the reasons he mentioned, doesn't really make much sense to any of us, who are in the health sector. Now, going back to, yes.
Yeah, please continue.
Bangladesh, and see what happened in Bangladesh. As Mr. Shahidul rightly mentioned, there was a delay in decision making. COVID was declared as global emergency in early March, but you have seen, what happened in Bangladesh. Even there are some general kind of couple of member of parliament election. I think I forgot the date, late March. And a lot of delays in decision making. They made decisions on social distancing, lockdown. But you have seen how the garment industry behaved. They declared that factories open. You saw hundreds and thousands of human trafficking. Traffics coming from villages rushing to Dhaka city. After a couple of days, again they're going back. You have seen that. I think Bangladesh is the only example where even until today, after repeated government instruction, you need a COVID certificate to be admitted in a hospital. Even if you are a very severe acute patient, so with severe heart disease or if it's severe diabetes, you need a COVID certificate. That means the entire health system has been broken down, and there is no consistent policy. The strategy has been lacking from day one. And another angle I would like to mention here, the role of the private sector. That today that 70%, almost 70% of health expenditure in Bangladesh is basically out of the pocket expenditure. And this money is spent basically on medicine, on lab test, and on private health facility. That means the role of private sector, the private hospitality is growing bigger and bigger. But what we have seen complete non-cooperation of the private sector hospitals, to kind of join hands and fight against COVID. So there are many things we can discuss hours, but I think because of the time limitation, I will stop here. Thank you.
Okay, thank you very much. And you lost your mother, we know that, and we followed your frustration about the healthcare of Bangladesh, and particularly that hospital. So you want to add something? What's happened with your mother, very briefly?
I don't want to go too much into my personal thing. Yes, I lost my mother on 23rd of April. She was admitted in United Hospital. That hospital actually got fired last night. Everybody knows about it. And for the first time I heard in my entire medical career that a patient under life support was discharged. My mother was under life support in United Hospital as a COVID negative patient with severe lung condition, but suddenly they found her with COVID positive, and she was under life support, and she was discharged, and she was transported to another hospital without any similar or equivalent facility. And that eventually caused hypoxia, her damage in her brain cells, and that eventually caused deep coma, and she never wake up, and she eventually died after 7 days of that discharge. I spoke about it. I sent petition to the Honorable Prime Minister. I sent legal notice to the United Hospital, and cross fingers if any legal action is taken against this, inhuman misconduct.
Yeah, our deepest condolences for this great loss. Yeah. Now I want to move on. Sabria Choudhury, you very recently contributed a book. What is? Can you tell us very briefly what is about?
Sure. So the book is called Bangladesh: A Suffering People Under State Terrorism, and it's a collection of essays from quite prominent writers, including the former Chief Justice S.K. Sinha. And we've compiled a number of essays to talk about the lack of transparency in the current government of Bangladesh, the lack of free speech, the lack of any kind of freedom of thought even, and the fact that we have an unelected government that has been ruling single-handedly, and in fact, we can say pretty much a single-handed dictator since 2009. And it just seems that there's one crisis after the other, and COVID is a global crisis, but it just adds even more tragedy and crisis to an already very sensitive situation. Politically, the country was never strong in terms of any kind of participation from the electorate. So whatever we're seeing today in this kind of a major crisis, it's all a buildup of what's been happening since 2009. And the government is carrying on human rights abuses even during the pandemic. We hear about people getting arrested, people getting kidnapped, even during this time. So they're actually taking advantage of people being preoccupied with the health crisis to carry on politically motivated activities. So the book touches on a lot of different issues, the legal aspect, the political aspect, social, cultural, etc. And it was just released last month, and it's available now on Amazon. And yeah, we're already writing our second book.
Oh, thank you. Ambassador Millam, the US death toll surpasses 100,000, and when the reopening started, many states and in our DMV area, DC, Maryland, Virginia, where you live in Early, reopen will start on from Friday, next Friday. I mean, from tomorrow. So, do you think what will be the impact? Are you anticipating second wave? Because they are, still the indicator showing that it's not, flattening. So, but particularly in Northern Virginia and the District of Columbia. So, what is your thinking?
Well, Mushfiq, first of all, I let me say some things. I had not heard of Dr. Hyder's terrible loss of his mother, so I wanted to express my condolences to you now, while I have the chance to do so. It sounds like she had a terrible time, and it's been a bad time for you, I'm sure. And I also, to Sabria, I hadn't heard about your book, so I'm glad to hear about that. And it's on Amazon, you said, so I think I'll have to add it to my collection of books criticizing the Bangladesh in its present authoritarian configuration. I don't want to talk too much about the United States because we've done a very bad job on coronavirus, but being a fairly wealthy country, where I think most of us are like Sabria and I, who are here, have managed to stay inside and keep away from the virus itself. And while the poorer sections of our population are starting to feel a problem with food distribution, I don't think we've reached the hunger stage yet, as Shahidul described. But I wanted to, I'll really just go on to say, I thought it was very interesting to have both Shahidul and Dr. Hyder on the same program, because, correct me if I'm wrong, but in their own ways, each is an authoritarian state, I believe. Certainly Bangladesh is. I know quite a bit about Bangladesh. I'm not so, but I think that's true in Cambodia too. There's some studies out that talk about authoritarian states and how they've handled the virus. And some of them have done quite well. It sounds as if, from your brief description, Dr. Hyder, Cambodia has done fairly well at keeping the curve flat and keeping the death rate down. We know that Bangladesh is not doing that well. And I was just wondering if any of us can explain the differences between the two, and whether the study that I quote said that in the short run, the conclusions were that in the short run, authoritarian states are better at limiting the virus to begin with, but in the long run, they're not as good at keeping the population in the kind of shall I say, social distancing that we're all in now, so that the infection rate stays low and the death rate stays low. So I'd like to hear both of them sort of talk about what differences there might be in the approach of the two governments. My own surveys into history, and I've done a lot of reading, particularly about the 1918 pandemic, and quite a bit of writing about it too, suggests that one of the main things that's important is transparency. Now, it doesn't. We know that the Bangladesh government has not been transparent at all. I'm wondering if, in the case of Cambodia, there was transparency or how they accomplished it if they were successful in handling the virus, and whether Dr. Hyder believes that will continue. But so I think that's about what I'd like to get at is because I think we ought to focus on the U.S. is so well publicized that everybody knows what's going on, or most people do, and we've certainly done very poorly. There have been a lot of articles recently, and I just saw one today that we missed at least a 45-day gap between, say, early March and now, and the middle of April. It would be between the appearance of the virus, which was in January, and the middle of March, that when we could have done a much better job of tracing, of catching the virus, tracing the contacts and so forth, and we could have 40, 50,000 fewer deaths. We haven't done that. We've been terrible at that. We've had a government that's been in denial about it for many, many months, and still is, I think, in denial, although they continue to talk about it. But I'd like to get back to the difference between Cambodia and Bangladesh, if I can. I'm going to turn it back over to you.
Thank you very much. So I want to wrap up our conversation, and finally, I'll ask Shahidul Alam if you want to add anything from this conversation from the other panelists.
By the way, can I add something?
Yes,
I had a pop-up on my screen that said the meeting now has unlimited minutes. I don't know if you saw it or not, but it sounds to me as if we can go on more than 40 minutes if we want to.
Yeah. Okay. Okay, Mr. Shahidul Alam.
Okay, no, I think I've said most of what needed to be said, but I do want to talk about this thing. I mean, Ziabai did mention the situation of the garment factories, the fact that garment workers were told to come back to work and then sent back again and come back to work. And now we've got a situation where you have people who are allowed to go, but private vehicles are allowed to travel and public transport isn't. I'm not suggesting that there is a perfect answer. All I'm saying is, had it been well planned out, it could have been done very differently. Now, obviously, the people who were going to suffer the most were the people who were in the lowest rungs of the economic ladder. The people in the informal sector, the people who do not have homes, the people who are not in a position to save up, who do not have bank accounts, those are the people who really needed to be taken care of first. And while economic packages were given out, they were given out in the wrong order. They were given out on the basis of the interests of garment workers, garment factory owners and business groups, and not taking into account the situation of ordinary people. Had food, money been sent to homes of ordinary people, they would not have had to come out into the streets the way they did. Had the medical precautions been taken far in advance, had all of those sort of things had been concentrated on what was happening to the poor and planned for it well in advance, I think a whole lot of this pain could have been avoided. It still can, and I'm appalled that even now, instead of getting ahead, and Gonoshasta hasn't actually said that they want their test kit to be approved. They just want it to be tested. For the government to take so long just to test a kit, which the whole nation is crying out for, is ridiculous. And I'm appalled that we're allowing this to happen.
Yeah. Dr. Hyder, I want to ask about your working area, like your organization, World Bank, the global organization, obviously. So what the World Bank is doing in this pandemic in public health sector globally, very briefly, if you say a few words.
Well, World Bank has taken it very seriously. The World Bank Board of Directors, they approved a $14 billion package. It's combination of IDA and IBRD and combination of public and private sector investment. But out of 14 billion, 1.3 billion is given to IDA countries and 2.7 billion given to IBRD countries to the public sector. So that was done in March, mid-March. And out of that allocation, we are basically delivering funds to countries in two phases. The first phase is to basically help the health sector so that they can address COVID, mostly, containment, treatment, and so on and so forth, the health sector interventions. The second phase is basically social sector to, address all the risks that is caused by COVID, to mitigate risk in education sector, in social sector, in businesses. So that will come as second phase support. Specifically for Bangladesh, out of that 1.3 billion health sector financing, Bangladesh has got already $100 million. The Director General of Health, they are the independent entity, and this money is being spent, to buy all the required PPE, supplies, equipment, ventilators, other equipment for isolation centers, testing kits, also some remuneration incentive for frontline workers, who have been doing the surveillance, tracing the patient, so on and so forth. So that's in short what the bank response is, for this COVID issue globally.
Thank you. Sabria Choudhury, you want to add anything?
Yeah, I just wanted to add that pertinent to what Mr. Shahidul was saying, the disorganization that they are experiencing in Bangladesh, we can't say in the United States that the government response, not only from the White House, has been any bit more organized, not just talking about the casualties from COVID, but what about the survivors? What about the people who are waiting eagerly for a stimulus check from the government? They're not being able to go back to work. We've had the first wave of stimulus checks, and that was a month ago. And the second one, we still don't know what's going to be happening. The Senate is out on vacation. They have said that until June, they're not going to make a decision. They're waiting to see the impact of the first wave of economic stimulus. So it's complete disorganization as far as the health aspect is concerned, but also the economic aspect. The US unemployment rate has now reached 40 million people. There's 15% unemployment. And I don't understand what we are waiting for. We are told 100,000 people have already died, but we're told that we cannot, the people who need the stimulus packages most have to wait. At the same time, if they go to work, there's a risk, if they at all can go back to work. So the situation in the US, surprisingly, is not that different from Bangladesh as far as these points are concerned, health-wise and economic economically also,
Yeah.
which is shocking.
Can I speak to that?
Yeah, as
Yeah, I
final,
think she's right. I
as
agree.
final remarks.
I agree with Sabria in almost every way. I just thought I'd say something in a more explanatory way, and I'd like to hear others talk about this too. Although this may not in authoritarian countries be quite so pertinent. One of the problems is, and this is really sad, and it's just a mark of our times, that this epidemic, this pandemic, has become a partisan issue. Now, the government never did very well to begin with, and in order to cover that up and to get on with it, Mr. Trump's re-election, they have turned it into a partisan issue. So much of what is happening in Congress is held up by the partisanship that is going on in the country and in our politics. So the bills that you mentioned, Sabria, two of them, maybe three, have been passed. We've done it all wrong in the first place. The Europeans, I must add, did it right. Most of them. I don't know the details of all the European reactions, but I know that most of the European countries provided resources, lots of resources, which went directly to workers, but were tied to the fact that these workers would be kept as employees, so they wouldn't lose their jobs. They would be kept on the payroll. The U.S. government was paying the payroll. Their governments, not the U.S. government. The U.S. has done it very differently, tried to work it through the unemployment insurance compensation system, which is terribly outdated, very, very inept, and technologically about 10 years behind the times. So they haven't been able to move the money. A lot of it is just technological problems in moving the money. But there is also a lot of delay, and that's particularly for the next bill that's coming up, which the House is already working on and is quite proficient, $3 trillion, I think, which the Senate is, because of its partisan nature, is unwilling to look at least at this point. So our problems have been, really exacerbated seriously by this partisanship that has gripped our country in the last few years. And, well, maybe a few, but it's gotten much worse in the last 3 years under the present administration. And it's unlikely to get better. I think we're going to, I think there will be a second wave in America. And I think there is already a beginning, a wave. The virus has been kind of a patchwork virus. It hit the East and West Coast first. The middle of the country was relatively free of the virus. Now, because viruses move around, they don't pay attention to borders, or they don't have passports. And so they move around, and now there's Texas is in bigger trouble. There's increases in infections in all of the southern and Midwestern states, most of them at least. And so we're having a second wave begin now in parts of the country that weren't hit badly in the first time around. So, but it's all totally mismanaged by the federal government, which doesn't want to touch it. Has turned everything over to the states, including testing, which has been a serious problem. We're not going to get out of this.
Okay.
In the 1918 epidemic, which was really bad, we didn't know much about how to handle epidemics, but we did same things in 1918 and 19 of social distancing, closing, banning meetings, closing schools, and those that did it fast turned out to have to do it better with less deaths, less infections, less deaths, and a better economic recovery after the virus went away. And that seems to be, and there was absolutely no transparency in 1918. So this is the problem. And so some people never did anything, and some cities did quite a lot. But the total deaths in 1918, 19, and 20, because it went on really for 3 years, off and on. It wasn't constant. Was 165,000 people. We've already hit 100,000. Our population is 3 times bigger. We're probably going to exceed 165,000 before this pandemic leaves, or we get a vaccine, unless we get a vaccine very, very quickly. But, you know, I think it's been, I can sum it up, and I've talked too long, I know, but I think that it is primarily human misjudgment, human mismanagement, and, you know, driven by terrible partisanship within our society. There.
Okay.
Done enough for today.
Yeah, no problem. My last question to Dr. Hyder, how far we are to get a vaccine, but you are listening.
Well, this is a very, it's a question for scientists. I'm not a vaccine scientist, but
you are a
as
public
much as I know,
expert.
As much as I know, you know, it really takes time to develop and market the vaccine. You know, a couple of countries are racing to do it early, and a few countries have advanced, like China. They have advanced a bit. But, you know, before you can have approval from WHO or, you know, reach it out to millions of population, you have to make sure that vaccine is 100% safe. And in order to make it safer, you have to do a large scale, multiple trials. And that really needs some time. If you look at the past, you know, past history of the vaccine development, the average time is 1 to 2 years, you know, before a vaccine can effectively come to the market, you know, for general population. So we are looking at maybe, you know, mid next year or end of next year. I don't think there will be effective vaccine marketed prior to 2021, quarter 3 of 2021.
Thank you very much. It's a wonderful discussion, and I hope our viewers will enjoy our discussion. So thank you very much for joining this coronavirus outbreak conversation.
Thank you.
Nice to see you all.
Thank you.